someone suffered some damage.
So even if you've had a heart attack, there's still exercise and there's other things that you can do, which we'll get to sooner, that can actually help people
Absolutely.
improve the cardiac function. Let's talk a little bit more about the risk factors, because that's very important. The risk factors are anything that's going to compromise the blood flow to those vessels, through those blood vessels. Now, we've talked about diet, and we've talked about the fact that plaques form inside these vessels, cholesterol buildup, and that's one reason why we like to keep our cholesterol levels down, correct?
Correct.
Okay, what other disease processes are we concerned about?
Well, high blood pressure, which again is an epidemic in this country. 70 million Americans have high blood pressure.
Now, how does that work?
High blood pressure, again, to use the analogy, it's sort of like driving your car uphill all the time. It puts a back pressure on the blood vessels. It makes the heart work, it creates more difficulty for the heart to pump. And over time, it actually pounds the blood vessels, causing hardening of the arteries, atherosclerosis, both to the blood vessels of the heart, the peripheral circulation, meaning the legs, and the circulation to the brain.
So you get a problem with blood flow through because the vessels actually get injured, and the pump itself is overworked.
Yes.
Now, when the blood vessel diameter gets compromised, so not so much blood comes through, what else happens? I mean, there's still blood getting through. Why is there a problem?
Well, the heart is, it's a good question, because the heart is a remarkable organ. And in fact, until you get about a 70% blockage of the coronary arteries, the patient will have no symptoms. And usually they have a normal stress test. That's why prevention is so important, because you want to try to prevent blockage from even developing at all to 50%, 30%. You want to try to keep hardening of the arteries down.
Now, when you have that angina, that will go away if you rest. Excuse me, if you rest and you put less stress on the heart, so it doesn't need so much blood flow. But there are events where that pain just won't go away, where you have that tightness and that pressure, and you have that kind of classic motion, and it's severe pain. That's not discomfort. That's the real deal. Now, that's, I assume, something more than just the lack of blood flow. Something bad has happened.
That's exactly right. In fact, what's happened at that point is that the artery, which was only partially compromised, is now completely compromised, meaning there's a clot in that artery. It's not just an obstruction. It now is closed down, often either nearly completely or completely. What happened is that a blood clot has formed, and the artery has become injured due to what we call plaque ruptured. Platelets rush in from the blood to try to heal that injury, but platelets cause the blood to become more sticky and clot, and now you've got a completely obstructed artery where it was only partially obstructed.
So you have a normal process, which is, whenever there's tissue injury, whether it's, a cut on your skin, right, and you develop a scab and it closes up, or whether you have that same kind of injury but it's on the inside of a blood vessel,
right, the
same sort of process is going to occur. It starts off with these little platelets, these little pieces of cells, right, that combine at a spot and start the healing process. When you start the healing process in a vessel that's already compromised, it can shut down completely.
Exactly right.
And the tissues that are supposed to be fed by that blood vessel, they die.
And that's
right.
And
that's a myocardial infarction.
Correct.
Now, how can you prevent that? I mean, some of that, not everybody who's got an atherosclerotic plaque in their coronary vessels, they're all not going to have heart surgery or something to get rid. You can't get rid of the plaque. How do you prevent the clots from forming?
Well, it's one of the best treatments we have is actually aspirin. In an emergency situation, of course, you have to get to an emergency room, and there are means we can do to open up that artery, either with powerful clot-dissolving medications or sometimes urgent angioplasty and stents.
So if you have that severe pain and you're anxious enough to get yourself to a hospital, often, and I know we do this at Phelps, we have an acute system whereby we can infuse a product that will actually dissolve that clot. So that's something people should be aware of, that the severe pain, that doesn't necessarily mean that the damage is irreversible or permanent yet.
In fact, it's exactly right. We have these powerful clot-busting medications. In fact, Phelps, we're very proud to say, is one of the best in the state in getting that medication in as quickly as possible and with our acute coronary care. So we should take a lot of pride at that at our hospital.
So aspirin, which we hear about all the time, prevents that clot formation. Now, does that mean that you said 1/3 of the population has coronary artery vascular disease? Does that mean that everybody should be taking aspirin?
Not everybody in the population, but certainly patients who have had any kind of coronary disease at all, meaning they've had a myocardial infarction or they have angina. But many other patients as well should take aspirin, including those with diabetes. and others who have risk factors, and this is meaning high blood pressure and high cholesterol. Smokers should generally be doing it, but that's a question that you do have to ask for, your doctor, because aspirin does have some risk.
Now, how does smoking affect the blood vessels? People are very aware that smoking, causes lung disease. They're unaware of the fact that it causes bladder cancer. But how does it affect the heart vessels? It seems like a long way from the lungs to the heart vessels.
Smoking by itself causes tremendous damage to the blood vessels. In fact, the primary risk of smoking, tobacco use, particularly cigarette smoking, is heart disease and stroke.
Now, why is that? How does that happen?
Over time, the nicotine and other substances that are inhaled cause damage to the lining of the blood vessels.
So that can
everywhere
happen
in the body,
right,
from head to toe.
Now, are there other dynamic changes that occur when you smoke?
Yeah, sometimes actually coronary spasm, meaning a patient that actually has pretty normal arteries, even a young person, can actually have the artery close down from spasm. In fact, I actually did some of the largest research ever performed on this in heart attacks in young people, which unfortunately neither you nor I fall into that category, 35 years or younger. And in fact, the arteries were normal, and those patients were all smokers because it caused spasm and clotting.
Now, we've seen those infrared pictures that show after you smoke a cigarette, your extremities get cold because
right,
the vessel is shut down. That's essentially happening at the level of your heart as well. And if you already have compromised vessels and you're smoking, well, then you're at risk for myocardial infarction, actual injury to the heart vessel.
Exactly right.
Not to mention the injury that we talked about. So, obviously, cutting smoking, that's a certain thing you can do to prevent cardiac disease, or at least to limit your risks. And I think that's a heart attack is probably a major contributing factor to quitting smoking. What about a diabetic? Why does diabetes affect the coronary vessels?
Diabetes over time also affects the blood vessels, both large and small, meaning the big arteries and even the tiny little arteries, really from head to toe. That's why control of diabetes is particularly important.
Okay, so we talked about high blood pressure, very common. How do we control high blood pressure? We have people that are on dozens of medications, sometimes 4 and 5 medications to control blood pressure. Why so many medicines, and how do they work?
It's a good question. I mean, years ago, we didn't have very many medications to control high blood pressure. Now we have many, and we use many. It's interesting, people who complain about having to take multiple medicines for high blood pressure, they're actually right, but that's the way the treatment has evolved, such that we can do such a good job with high blood pressure. Most people, research shows, most people are on 3 and 4 medications to control their high blood pressure.
Now again, what that does is it diminishes the work that the heart has to do, and therefore it diminishes the amount of blood that needs to flow to the heart to keep it functioning and alive. The agents that are available, we've talked about aspirin and the controversy of half an aspirin, a quarter of an aspirin, a full aspirin, every day, every other day. Is there any consensus yet, or it's pretty much, we know that aspirin is good, we're not so sure how much is good yet?
There's still a lot of debate. I have a lot of patients who take 81 milligrams of baby aspirin. Right. I have a lot who take 2 baby aspirins and a lot who take a full aspirin as well. So there is still debate, and the dose may be different in women and men, but to suffice it to say that most people, virtually everyone with coronary disease, should be on some form of aspirin.
And we've talked about the fact that not everybody has to be on aspirin, but certainly if you have those risk factors, you should be doing it. Yes. Now, other medications, the anti-cholesterol agents.
Yes.
Will the anti-cholesterol agents take away plaque once it's formed?
No, what they do is actually, there may be some reversal, but they can stabilize plaque, which is very important. If you, as we mentioned, a lot of people, even from their teenage years, have some form of plaque. But what we want to prevent is progression of that plaque, prevent it from getting worse.
Right.
And if you have a plaque, stabilize it so that it won't rupture and cause an acute coronary syndrome. And these medicines are remarkable.
Do they also prevent more atherosclerosis from forming?
Absolutely, and there's unequivocal evidence. Research study involving hundreds of thousands of patients show that number 1, it prevents stroke and heart attack, and number 2, if you've had a heart attack or stroke, prevents a second one.
Now, how about diet? Does diet seem to do the same thing if it's followed extremely aggressively?
Diet's very important. Just because you take a medication doesn't mean you don't have to watch your diet.
So you still have to be heart healthy.
You still have to be heart healthy, exactly.
Nitroglycerin is a medication that people often carry with them if they've had a history of heart disease. If you've never had a heart attack, you still need to carry on nitroglycerin. Now, I'm not talking about people who've never had